Hello out there in television land. It is yet another edition of It's Your Health. Philip Benyo with his bride, Kathleen, bringing you the latest and greatest in healthcare information.
Yep.
And I'm sure you're wondering what this little item is.
Yes.
Well,
I think I know.
in show business, sweetheart, we call this a tease.
Why?
Well, it's kind of like you. A tease.
And how is that?
We'll be right back after this brief commercial message.
Sleeping on the sofa tonight.
You're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the first segment of It's Your Health, the fastest 30 minutes in television history.
So how'd you like that cartoon they just showed?
How about that? Those are new stress test
You don't need
techniques.
stress tests anymore. She's holding up spiders.
Well, as another...
Yeah. The worst thing would be if they held up snakes. That
Yeah,
would be bad.
I agree. But we're going to talk a little bit about how to maybe get your coronaries evaluated without a stress test. That's going to be coming up a little bit later. Another
okay.
tease, right?
Without the
spiders.
Spiders. Okay. Would you like to do some headlines?
Please.
Well, I got news for you. We're doing them differently. I'm going to ask a question. You're going to provide the answer, and that's the way we're going to do it this time.
Okay, but you'll put in your 2 cents, I take it, right?
My 2 cents. I have more than 2 cents.
Okay.
Okay. What interventions are effective in managing chronic low back pain?
Yeah, it's interesting because they did studies where they put patients with lower back pain into 3 different groups. One is they had physical therapy and traction. The other one was medications. And the third one is they did nothing except tell the patient to exercise. And it turns out the ones that were given exercise did the best. They did the best. So
Not a
exercise
surprise.
is your best friend.
So that's why yoga is such a good, that's a big deal.
Yes, it is. Yes, so we can manage it that way.
Okay, next question. Do muscle relaxants provide relief for non-specific lower back pain?
Well, I'm not a fan of medications. First of all, the non-steroidal anti-inflammatory drugs elevate your blood pressure, can mess up your kidneys. They have GI side effects, put you at risk for stroke and heart attack, by the way.
Oh, gee.
Muscle relaxers, very sedating, have significant drug interactions, so we don't want to push the medications that far. And again, we go back to basics. Just maybe try some exercise. People are in such a hurry to get better. With all the modalities out there, people who have acute back pain, no matter what you do, they get better in 2 weeks. So just sit tight. We're in a microwave society that wants instant gratification.
I don't know. I've had my back pain forever.
Talk about instant gratification.
Yeah. Next headline. Are patients reassured by negative MRI findings for low back pain?
I found this study to be very interesting. If you tell a patient, well, you know, your MRI looks pretty decent, we didn't find anything horrible, they say great, and they feel better. But when you tell a patient, or they have access to their medical records, which I have no problems with, and they read all these other things in there that relate to maybe it's not entirely normal, but there's nothing you can really do about it.
And we don't understand it either.
So when given bad information, guess what? Their symptoms are worse. So figure that out. It's almost a negative placebo effect.
Wow. All right, well, you're saved. Those are all the headlines.
Okie doke.
Okay, we're going to talk now about osteoporosis, and all of us who are older should be aware of that, including men, right?
Yes, osteoporosis is probably one of the leading underdiagnosed and undertreated conditions in postmenopausal females. Guys too get osteoporosis, which is actual bone loss. So one of the keys, of course, is if you measure your height and you're a few inches smaller than you were before, then that's a pretty good sign you have osteoporosis. We're going to talk a little bit more about this. DEXA scans are crucial, paid for by Medicare, to actually put a number on what your bone density is.
And they don't hurt at all. But I did want to mention, we were talking about osteoporosis as it relates to exposure to high levels of air pollution.
Again, it's kind of an odd finding. I'm not sure we can really explain it, but people who are exposed to air pollution, city dwellers, for example, have had higher incidences of osteoporosis or bone loss. So let's stick with country living around here, right?
So you're going to tell us about that now or not yet?
Oh, no, not yet. No, don't get excited.
Not yet. Okay, well then I'm giving this to you.
All right. Well, get a load of this chart. What we're talking about here is GLP-1 and brain chemistry. And everyone knows, of course, that the country is getting wider, and I always blamed the pasta and breads as causing obesity. However, get a load of this. There's three main issues of obesity. There's eating for hunger, which is driven by hunger and satiety pathways in the brain. That means satisfied. Then there's hedonistic eating, eating for pleasure. And then the third one is executive function, which is your brain saying, you know, I really want to eat now, deciding that you're just going to eat. What they're trying to get at is the brain is the master regulator of food intake. And so they've developed a drug that we're going to get into a little later that is going to master these two things. And these drugs work in such a unique way that people who are on them, the fat just rolls off them. Ozempic comes to mind, but there's another one called tirzepatide, has caused unprecedented weight loss because they factor in all these things. They make your stomach think it's full, which in turn tells your brain that it's also full in terms of satiety or the need to eat. So these are upcoming drugs that have great, great value in terms of weight loss. Now, if you want to get into your teas, you can.
Well, I was just going to mention that treatment of people with obesity but not diabetes produced unprecedented levels of loss of weight by using this new drug.
Right, and I think you're going to end up giving yourself a shot maybe once a week. And again, it's going to block these pathways to hunger, and you're going to affect weight loss.
Wow. So what about this?
Okay, now this is a great, great thing to keep in mind. I see numbers of patients who have painful fingers, stiffness of the joints when they wake up. In the old days, we would use paraffin wax heated in a double boiler, and you'd put your hands in there and work the heat in. Now they've come up with this item, which we got on
Amazon.
Right, a couple of bucks, and what it does is it has its own wax, which is
Smells good.
is it called aromatics? So you put the wax in here, you set the temperature to what is going to be nice and safe for you. You're not going to burn yourself.
Well,
And-
first you're going to set the temperature higher, and then when it gets there, then you're going to cut it back down so you don't.
Okay, sounds good. And you put your hand in there, and then take your hand out and put a glove on, a plastic glove, which is given in this particular thing, and work in that hot paraffin wax. You will feel like you're 18 years old. And this is good not only for your hands, but it's great for your feet as well. So again, I really urge you, most people who have had hot wax paraffin treatments feel like they're just got their mobility back. And it's safe and without side effects. So we're all for that, right?
And you don't have to put your hand in. You could get like a spatula or something from the kitchen and just, you know, wipe it on. That's all you have to do. And it will dry, and you can reuse the wax.
In the heat of full disclosure, what do you know about spatulas in kitchens? Nothing. Well,
It's time to go to the next segment, I think.
we'll be right back after this brief commercial message. Remember, you're watching It's Your Health.
Yeah, I hear you. Welcome back. We're happy to have you with us. Not so happy to have him with us right at the moment, but I'll do the talking and I'll let him add a little bit here and there.
As usual.
As usual. Boy, you're on a roll today, aren't you?
Oh, it's the end of summer.
Yes, it is. Let's do headlines.
Okay, go right ahead.
Do I know where the kitchen is? All right. Question. Are short antibiotic courses as effective as longer courses for common infections?
Yes, we're getting away, and I've always said less is more. In the old days, we would give an antibiotic perhaps 10 days for bladder infections or bronchitis, but it turns out we can get away with 5 days generally. And again, it's a judgment call in terms of your particular case and what your doctor tells you. Prolonged antibiotic use can cause more problems than it's trying to solve. So again, we want to be a little judicious in our antibiotic use.
Our dog is on antibiotics for 10 days.
Oh.
So that's okay then, because that's what the doctor said he needed.
Then that's what you go by.
Okay, next headline. What is the likelihood that other adults with prediabetes will develop diabetes over an average of 6.5 years?
Right, a good question. We will often do a blood count on a patient and find that their glucose is elevated. We'll order a hemoglobin A1C, which is the average blood sugar over a 3-month period of time. So you can be pre-diabetic, which means that your sugar's up more than it's not, but you're not enough to classify or treat for diabetes. Now you would think that they would go on to diabetes, but according to this study,
they don't.
They didn't. No, they didn't. No. Most 90% did not, perhaps because we intervened and said, look, you're sweet enough. Cut back on some of this pasta and breads and lose some weight, and this will go away, and it generally does.
Next headline. Which over-the-counter products are effective in treating chronic constipation?
Yeah, well, of all the ones that are out there, the ones we've had the most success with is Miralax, which is virtually non-absorbable. What it does is put some bulk into the stool, retains some fluid, which is essential. Keep in mind, though, if you have constipation, it should be evaluated first, then treated, because the last thing we want to do is treat something that is caused by another illness.
Okay, so diarrhea could be a symptom of something.
Right. You know, you'd want to get up-to-date colonoscopies, make sure you're not having drug side effects, thyroid issues, things along those lines.
I've got a headline here that I have a feeling you want to play with.
Well, exactly. Get a load of this. This is not the price of gas. This is not the index of inflammation. It is the increases in the old U.S. population aged 85. So what this graph shows that is if you hit 85, chances are you're going to go on for a couple more years. And this is exactly what this shows. So that in a 10-year span of time between 2020 and 2030, the amount of increases in 85-year-old individuals is going to go up at least 2 to 3%.
That doesn't sound like much, but that's a lot.
That's a lot. These baby boomers, if you hit 85, you're going to maybe go on and beyond. And why is this important? Because as we age, one of the fears we have is falling. We are one fall away from a catastrophe. So there represents what's called the fear of falling. Now, you fell once, right?
Uh-huh.
And were you somewhat fearful after that?
Uh-huh.
So the fall creates a fear of falling, so you become more sedentary, you sit down and channel surf, and you become deconditioned, and guess what? That sets you up for more falling. So there's that fear of falling. There's actually a chapter in our geriatric books that talk about the fear of falling. Now, why is that important? 30 to 50% of household people over the 65 fall each year.
That's just about half.
That's just about half. Now, if you're 80 or older, this increases to over 50%.
More than half.
More than half. 50% of all nursing home patients fall each year. 50%.
Wow.
And 60% of patients with a history of a previous fall, they're going to fall again.
Uh-oh.
Hence that fear of falling. Now, why is falling game-changing? Get a load of this graph. If you decide to fracture a hip that is life-altering. 20% of you who have a hip fracture will die within a year. That is alarming.
That is alarming.
30% of you who suffer a hip fracture will have a permanent disability. Permanent, 1/3. 40% of you who have a hip fracture will be unable to walk independently. 40%. And I think this is the most important thing. 80% of you who have hip fractures are unable to carry out at least one independent daily activity. That is washing, bathing.
Dressing.
Right. The things that are part of daily activity. 80% of you will not be able to do that. Game-changing problems. So what do we do about this? What we do is we screen you for osteoporosis because we can intervene and we can put you on a different path. We're back to bone density tests. Now, you had one and I had one, believe it or not. It's a simple picture of your spine and your hips, and they can assign you a number of how your bones are, how fragile they are. And there's good treatments out there that can intervene and actually slow down bone loss, and in some cases reverse it. So why would you want to wait till you fracture a hip? Anybody out there in television land who's postmenopausal, age 60, 65 or over, and you're a little shorter than you should be, then you really need to get a DEXA scan. You can get one every 2 years and have an intervention planned. What do you think?
I think that makes a lot of sense.
Right. I mean, it's so preventative when you feel, when you understand that a fracture is game-changing.
You wouldn't believe, you wouldn't think it. You would think, okay, so they broke their hip, big deal. That's going to get better. That's going to be the end of it.
Well, it is a big deal. And what is also interesting is people break the hip and then they fall. Although I guess in some cases you fall and break your hip, but nevertheless the neck of the hip joint goes into a very narrow neck. That's why they call it that. You have the head of the femur going into the neck, and the neck is thinner, it snaps. So, and then of course you should get your vitamin D levels checked as well. And again, activity is crucial. Of all the things I could suggest to you out there, exercise and staying fit will put osteoporosis a little bit further away in your life. So,
isn't it true that some drugs are detrimental to falling, that they could actually not cause it, but help it to happen?
Well, that gets into polypharmacy, which we're going to talk about on our next segment. That was a nice tease there, sweetheart.
Another tease.
She's teasing all the time.
Oh, I'm going to tease him when never mind.
We'll be right back after this brief commercial message, right?
Right. Don't you just love that commercial?
Yeah.
Isn't that you sleeping on the floor while Donnie and I sleep on the bed?
Been there, done that.
Uh-huh. You're very comfortable like that, too.
I'm sure.
Didn't even need a sofa. Okay, we'll be serious and let's do some headlines.
Okay, go right ahead.
Low-calorie ketogenic diet improves immune function. This diet is emerging as an effective strategy not only to promote weight loss, but also to manage many comorbidities associated with obesity, including COVID-19.
Yeah, I found that interesting. Again, we're back to pasta and bread, not to pick on those industries, but they are the opposite of ketogenic and apparently put you at greater risk for having problems with your immune system and hence COVID-19.
Wow. Next one is how we treat acute pain could be wrong. Treating pain with anti-inflammatory medication like ibuprofen or aspirin may promote pain to last longer.
Again, it's revolutionary because it suggests that what we're doing is 180% wrong. Inflammation and pain is the body's way of sort of healing itself. That's what inflammation does to some degree. it helps heal itself. So by giving you anti-inflammatories, we are actually telling the body not to do its job, and can be promoting your injury or illness or pain a little longer than it should be. I find that fascinating.
And you shouldn't block the inflammation.
Right. It's kind of like when you have a fever. You know, when I get sick, I let that fever run
I
as high as
know.
it can, and I feel better within 24 hours.
It's true.
Fever's your friend.
Nobody believes you, but it's true. Okay, this is a tough one. Failure to eradicate polio allows a resurgence of this dread disease. In June, polio was identified in wastewater in north of New York City. The fact that it wasn't an isolated occurrence was confirmed by additional coverage, and now it's appeared in New York City itself. It potentially could affect millions.
Yeah, I mean, I thought this thing was dead. We've been vaccinated against polio as kids. I guess the question is that immunity good as we're now adults? And so this is a disease that should have been eradicated. And it just wonders, you know, are we in the end of times? We have the COVID virus, we have monkeypox, we have polio coming. What's next? So it gets a little crazy
We
out there.
haven't had polio since 1979.
Wow.
That's a long time, and it's easy to give to somebody else.
It is highly contagious.
That's
It's a
what I'm
highly
trying to
contagious
think
virus.
of to say. Yes, and so, can you give it to your dog?
I don't know, can you?
I don't know. I hope not.
No, I hope not too. I'm not sure.
Okay, we're going to talk about adverse drug effects in older patients. Would you like to talk about this?
It's one of my pet peeves.
Yes, it is.
Less is more in my line of work, and you end up seeing specialist after specialist, which is fine, who throw in to the pot what they think you need, and all of a sudden you're on 10 or 12 medications, and nobody's monitoring this stuff or being a quarterback. But get a load of these statistics, please. 1/3 of all prescriptions go to 13% of our population over the age of 65 and older. 94% of home-dwelling women over 65 take at least one medication. 12% take 10 or more. The absolute and, of course, relative number of elderly is growing rapidly, as
know
we've shown that before. And the frequency of adverse drug reactions in the elderly is very high, up to 10 to 35% per year. And an adverse drug reaction means that the drug itself could be causing a side effect. You could have drug-to-drug interactions, which can cause side effects. And, you know, it just, the list goes on. And what happens in my line of work is that patients who have a symptom are given a medication. The medication causes side effects. And so someone says, well, let's treat the side effects with another medication, which is totally absurd. We treat side effects of drugs with more drugs. Many adverse drug reactions are preventable. 27% in the primary care setting were felt to be preventable, and 42% in the nursing homes were felt to be.
Wow.
So
42%, that's a lot.
There is no pill for every ill, and I think that's the take-home message here, is that, you know, the most dangerous thing that I have is my prescription pad. So don't bug us to give you pills.
Sometimes you just have to work through it.
Again, nobody says no.
You do.
So do you. Now you talk about it.
Talking about teasing. Okay. Coronary artery calcium scoring for prevention of cardiovascular disease. It can identify high-risk patients who are likely to benefit from pharmacological therapy for primary prevention of CVD.
Well, again, going back to that stress test cartoon, in the olden days, if you wanted to get an idea of where you are in terms of your heart health, do you have a blockage, you'd go for a stress test. I did 10 years ago. And so I asked the cardiologist, you know, I'm wondering if I should have another stress test. He says, no, you should go for a coronary artery calcification score. And what that is, it's a CAT scan of your heart and your blood vessels. There's no dye, no injection, and they can look at how much calcium is in your artery. And there's ways for them to figure out how much of a burden the calcium is on your coronary arteries.
Did you have it done?
No.
Okay.
I'm kind of old school. I think I'm going to go for a stress test, because what this doesn't tell you is, how much can I exercise? Am I out of shape? So it's just one of the newer things that is non-invasive.
Okay.
All right.
Now we'll change the channel a little bit and talk about COVID-19.
One of the big things we're seeing, of course, besides the resurgence of COVID-19, these patients who are vaccinated are not getting sick. But what we are seeing are the people from months and years back who are now falling into the COVID-19 long hauler syndrome. And because this is a disease that can affect every organ, I find that it tends to affect the organ that you're probably most susceptible. If you have asthma or COPD, guess what? You're going to have chest pains and shortness of breath. If you had a little bit of a dementing illness, guess what? You have this brain fog. A big problem, because we don't know what to do about it, and it's becoming an epidemic.
Okay, I'm not going to say anything because everything I was going to say you just said.
Really?
Yes.
You mean you're speechless?
No, I'll go to the next one.
Okay.
I've heard the term medical odyssey mentioned in context of COVID-19. What does that mean? Or according to COVID-19 or other chronic conditions?
Right. Well, again, as I mentioned earlier, we have people who are undiagnosed or have an illness that they're not happy with having, and so they see physician after physician. You go to a cardiologist, he says, well, this is your heart. You go to a neurologist, this is in your head. You go to a GI person, they say, well, this is actually from your bowels. So you end up in a what we call swim lane, so that you're being treated as if you just have that one illness by that one person, and they all throw stuff into the pot. There's no quarterback who's overlooking all this stuff, and so you end up on a lot of medications, frustrated, undiagnosed, untreated, and part of this is COVID-19 as well. So it's one of those things. And the other thing to keep in mind is that diabetes is tied to COVID-19 as well, the long hauler. So if you have diabetes, chances are you may have some COVID-19 long hauler issues. I'm out of breath. I think we're almost done, are we not?
Yes.
Well, thank you again for allowing us to come into your homes and inform and hopefully entertain you, right?
He's in a talkative mood today.
So, do you want to close this out?
No, go ahead.
Okay, well, thanks again. Be safe out there, be kind to one another, and we'll see you on our next edition of It's Your Health.
Thanks, Sammy.